I guess I'll start with ISDs. We are seeing cases on campuses, pretty much on almost every campus in all the ISDs here in Hays County. We're relying on the eyes and ears of the nurses and the staff there because they know exactly what is going on campus. And so they're able to determine and do the contact tracing of who was there, who was being at high risk for a potential exposure. And then we consult with them, work with them, and all evidence is showing that they're not having any spreading that is occurring on campus. It all seems to be occurring from outside activities away from school. Um, Same thing with the Texas State University. Their numbers are ticking up just a little bit. But again, they are doing their own contact tracing. We're consulting with them. And same thing, there's no evidence of classroom spreading or on-campus spreading. It all seems to be occurring from off-campus events.
Hi, everyone. So I'm sure a couple weeks ago, y'all noticed that we took about 200 cases off of our total case count for Hays County. The reason we were doing that is because we were holding on to some cases on our report that weren't actually ours or were transferred off or were duplicates. So for one reason or another, they weren't actually true cases that needed to be reported out. So because of that, we needed to do a big correction on our end of day report. The main reasons why those cases were added in the first place, like they're still occurring, it can be from a person getting a COVID test at 2 different clinics, and the clinics put down their name differently. So whenever we go and we data enter that person onto our line list, our internal auditing that we have doesn't automatically flag that case as a duplicate, so it gets added. So in order to catch that, we have to go and do more in-depth auditing to go and manually identify that case as a duplicate and flag it to be removed. So if we did not remove that case from our end of day report, then the numbers that we're putting out to the public would not be as accurate as internally our own records show. Every Friday, we're going to run an internal audit to identify the amount of duplicates that we identified in the week prior, and then deduct those from the total case count. That way we're able to guarantee validity between both lists and give the correct numbers to the public. Yeah, because also some of the cases that we might have to take out is also transfers. So somebody may have gotten tested in Hays County. However, the clinics, they don't really check to see what county that person's actually a resident of. So they'll send the case to us. We'll add them. Sometimes it'll have a local address, sometimes not. If it doesn't have a local address, then we automatically transfer it out to the correct jurisdiction. However, if somehow it sneaks on and then eventually through contact tracing or we get better records from the medical facility, we're able to identify it's an outside jurisdiction case, well, we'll transfer it out. However, it was already snuck onto our list because of the way the clinic reported it to us. So that means that it has to be deducted from our total case count.
Someone had asked the question of at what point, at what point would we advise shutting down things again? As a health department, we provide recommendations to the elected officials, but ultimately it's the elected officials' decision. It has a lot to do with, our cases per day, our positivity rate. A concern for us is the upcoming Thanksgiving. I know it's hard. Everybody is having a little bit of COVID fatigue right now. They've been dealing with this since March, haven't seen loved ones, haven't seen family, and everybody wants to get together for the holidays. And I understand that completely. It's not something that we are recommending in any sort of way. But if you do have to get together with your family, if it's something that you've already scheduled and you're not going to cancel, we just want you to do it safe and do it the proper way. Outdoor picnic style would be ideal. Having large gatherings of people from all over indoors is just increasing your risk of somebody who might just be asymptomatic and could be spreading it throughout the whole family. But making sure that you're wearing masks, being outdoors, washing your hands. I know it's family. Everybody wants to see each other and embrace each other. You haven't seen them in a long time. But a fist bump is just as loving. You haven't touched their hand in a long time, rather than a hug, rather than that kiss that you haven't seen them. We just want everyone to be safe. We're here to try to protect everyone. We're definitely discouraging large indoor gatherings for Thanksgiving, but like I said, if you have to do it outdoors. Have fun. It should be beautiful weather still. Outside, less chance of spreading.
But I was wondering specifically for Hays County, if you could tell me what the hospital capacity is like, what percentage we're currently seeing of COVID patients overall, and if there are any individual hospitals that are currently being maybe not overrun, but are at capacity. We got a tip that maybe Ascension and Hayes was, but I'm not sure if you know.
No, at the moment, our hospitals, there's plenty of beds, there's plenty of ICU space. Excuse me, sorry. There's plenty of ICU space. We have not heard of anybody being overrun. A lot of the COVID patients that are having extreme issues need ICU, need intensive care. They are being transferred to hospitals, usually in Austin or into San Antonio, away from our 3 hospitals that we have here. So at the moment, the 3 hospitals that we have are not at full capacity in any sort of way and still have plenty of space.
Hi, this is Karima Hernandez from Univision. My question is, we know that 45% of the Hispanics in your county, or 45% of the affected in your county are Hispanics. What are you guys doing to help this community affected by COVID?
So, we have created a partnership with Curative, free testing for any Hays County citizen. It's actually free testing for any citizen at all. So in all 5 of our major cities, we now have a place set up to where it is free testing for anyone. So that is what we're trying to do, is identify the people who are not showing symptoms but are testing positive. And it's definitely working. We have seen our testing numbers start to skyrocket, especially in the Kyle, Buda, San Marcos area. Where Curative is testing somewhere around about 500 people a day almost now. And so identifying those individuals that are asymptomatic, and then also it allows people to not just have themselves tested, but they can take the whole family there. And they're doing the cheek swab rather than the nasal swab. And so we're seeing a lot more children actually get tested as well, because it's less invasive and parents aren't as intimidated to have their child's cheek swabbed rather than, tickle their brain with a Q-tip. We're opening up the testing, identifying people, and just being able to allow free testing for anyone is one of the major things that we're being able to allow to that population.
There's also a free mask giveaway later tonight from 5 to 8 p.m. It's at the Centro Cultural, and I believe that's 211 Lee Street in San Marcos. The Hays County Emergency Management Team was able to secure about 5,000 N95 masks for that distribution. And so, Hays County, and I think the city of Buda also gave some funding to local school districts, which, a lot of our school districts here have more than 60% Hispanic kids. So I think there are efforts underway to assist in any way possible. There's also a couple of different programs around for small businesses, and including the one through Hays County is the ECAP program that's run through the Greater San Marcos Partnership, and they give grant funding to small businesses to assist with COVID-related expenses. So there are definitely some things going on in Hays County to help everybody, but I think specifically for the Hispanic population.
Yes, I have a question about the residents who are not students or who are not first responders. Are there any accommodations for them if they are in quarantine?
A lot of the larger churches in our area have been able to help and step in and provide with that kind of resources for individuals.
The Hays County Food Bank has done quite a bit to help people. I know there have been some mass distributions through that organization, the city of Kyle, and some local churches.
Thank you. I'm just wondering if, based on the surge that we saw earlier this year, do y'all have any projections or expectations for this surge? How it will progress, how long it may last, if there's any sort of correlation available?
Earlier this year, about what the number of cases that we're seeing right now per day is about where we were right at the beginning of May. And then we had the Memorial Day, Father's Day, 4th of July surge that sent us skyrocketing, and the rest of Texas skyrocketing as well. that is our concern that we have right now, is the fact that Halloween, Thanksgiving, and Christmas and the New Year's right coming up, large gatherings, people wanting to get together. We're hoping that we don't see the exact same kind of increase. But unfortunately, at the moment, we are kind of trending in that exact same pattern.
And I will just add here, Eric, that, and this might be Kim's personal belief, but I think it's a reasonable one, that so much of what is happening right now, we all have control over how we interact, when we wear masks, how much we distance ourselves, if, not going out in big groups. So a lot of the control for this, I think, is on us, like each of us in the community, and remembering that we do these things to help everybody else and the most vulnerable in our community. So if there were anything that I could implore among our Hays County residents, is to keep doing what you're doing and be vigilant and don't relax. It's all in our hands, like literally it's in our hands. And while we can encourage and we can, have mandates and we can do all these things, I think we just all need to take it upon ourselves to make sure that we do our part to slow the spread of this virus.
Exactly. Yes, we're going out in public now. If you go to a grocery store and think like you're starting to see people who are getting a little more relaxed with the masks. They're wearing it under their chin. They're carrying it in their hand. We need everyone to understand that we are still in the middle of a pandemic. This is all of us working together to try to make sure that we don't have to go into a quarantine and a lockdown again. We are not here to try to shut down businesses, shut down schools, anything like that. But if we continue to see the rate that we're going at right now, and we see the same thing that happened in June and July, that's going to be something that the elected officials are going to have to address if we start to see a spike again. So it is up to all of us to try to make sure that we're protecting each other.
And Eric, I know there was some new guidance that came out about children and mask wearing.
So the old guidance basically said, it had mask mandates for anybody that was 10 years of age or older. It's now basically saying, it's highly recommended that everyone wear a mask. Please put a mask on your child.
What kind of, are there any other community outreach initiatives that y'all have planned just to kind of jump on top of the surge?
I know that we are putting out some holiday messaging, and we're going to hopefully get some video out. And I know that we're also working with the other PIOs in Hays County cities and schools to try and push these messages out.
I was just wondering, just to follow up, Eric, I know you told us a little bit earlier that you are transferring some patients from Hays County to other areas like Austin, Travis County. Can you just explain that process and the reasoning behind that? Like, has that been standard protocol since the beginning of the pandemic?
It has. And those are the hospitals. They're transferring within their own groups. So Seton Ascension hospitals will transfer someone to another Ascension that has a larger COVID wing or able to provide that critical care. A lot of the people who do test positive that need that critical care are getting transferred to more of the triage hospitals that are in Travis County.
If I understand correctly, Eric, you can help me out here. I mean, we don't make those decisions. Those are all from the hospitals themselves.
Correct.
Right?
Yes. We're not transferring anybody. We're not recommending the transfer of anyone. That is completely hospitals doing their policy, how they want to handle things.
I just want to understand there's some misconception around how kids can spread the virus. Can we clarify the likelihood of a child spreading the virus from child to adult?
It can spread from child to adult just as easily as it can from adult to adult or child to child. There's no difference in the way it spreads. The risk that comes with this is the fact that a lot of minors are asymptomatic and tend to be carriers and don't know that they have the disease. And so they go and hug their parents. And that's another thing too. It's hard to isolate yourself from a 2-year-old, 3-year-old. They're needing constant care or attention when they're at school, daycare. And it's really hard to teach social distancing to a 3-year-old. So it can easily spread from child to adult just as it can to adult to adult.